Disability. Introduction to the Glasgow Coma Scale. If you have a head injury patient, a patient that has impaired consciousness, and/or there are concerns about drug and alcohol consumption, you might want to conduct a more thorough neurological examination called the Glasgow Coma Scale test, or GCS for short, as part of your disability assessment. In the OSCE test, GCS is only required for the subdural scenario. Remember to look at the environment around you for patient clues, such as syringes or empty vodka bottles. The GCS still requires you to assess a patient's respiratory rate, pulse, blood pressure and temperature, and oxygen saturation. However, it also involves recording other observations, such as pupil size and reactivity, and limb movements that could generally identify various types of neurological deterioration that would prompt an urgent review by the supervising doctor. There is a very close link between NEWS2 observations and GCS observations, because neurological changes aren't always neurological in origin. They could also be related to physical changes in vital signs. For example, desaturation is a common reason for lack of responsiveness. There are 3 parts of the GCS: eyes, verbal, and motor. There are 4 possible responses for eyes, 5 for verbal, and 6 for motor. For each component of the GCS, the top criteria is the normal response, whereas the lowest criterion is no response. If the response cannot be tested, for example, the patient cannot demonstrate movement due to broken bones, then the response would be marked NT for non-testable. It's important to note that in these neurological observations, we are looking for the patient's best response. That means if you measure an observation on a patient 3 times, their best, strongest response should be the one that is recorded on the GCS. So, how does a neurological assessment begin in the OSCE? Many of the steps are exactly the same as if you were performing observations on a patient without a head injury. You would read the patient overview document, and when entering the assessment station, you would perform the SPIN-PAPSR steps. You would also need to acknowledge and address any props in the environment, such as hearing aid or cigarettes. Remember, if the patient has a neurological injury, they may not be able to respond as they normally would, so look for other signs of consent, such as non-verbal cues. As you are interacting with the patient during this introductory stage of the neurological assessment, you should be paying particular attention to how well the patient can communicate, both verbally and non-verbally. Do they appear alert and attentive, or restless and lethargic?